My name is Cemil Purut, and I'm a cardiothoracic surgeon here at the LewisGale Medical Center in Salem, Virginia. I grew up in Charlotte, North Carolina, joined the military at 17, went overseas, spent 3 years there, and came back and did mechanical engineering at North Carolina State University. After that, I really wanted to go into medicine and applied to Duke University, where I was lucky enough to be accepted, and stayed there to do my residency. My grandfather was a physician. He was a great man in our family. His portrait hung on the wall, and my parents always told me I would follow in his footsteps. And that probably led to where I am today. I started off in mechanical engineering and loved it. I took a job with IBM in Charlotte as a design engineer, but I felt unfulfilled, probably because of the programming that my parents had done to me that I was going to be a surgeon. I quit that job and returned to obtain my pre-med requirements at North Carolina State and then applied to medical school from there. Originally, I wanted to be an orthopedic surgeon because that would combine my mechanical engineering background with medicine. In medical school, I was lucky enough to meet the late David Sabiston, who was a real pioneer in cardiac surgery. In fact, did the first coronary artery bypass grafting in the world. Dr. Sabiston took an interest in me and sponsored me through my medical school and then took me into his residency program afterwards, and it was a great experience to be with him. He was fantastic. While at Duke in residency, I did 2 years in a laboratory under a cardiac physiologist. We did primarily experiments on cardiopulmonary physiology. These allowed me to combine my mechanical engineering training, specifically in flow dynamics, to model the human lung in ways that had not been modeled before. These led to some insights into pulmonary blood flow. These led to improvements in postoperative care of cardiac patients. It was an exciting time. I finished residency in 1996. My parents still lived in Charlotte, North Carolina, and I wanted to be close to them. I took a job in Hickory, North Carolina at a small medical center and joined 2 other physicians there. It was such a wonderful place, and we had such a great practice there. It was a great hospital, and I ended up staying there for 20 years. We developed a valve program there for replacement and repair of cardiac valves. We did all manner of intrathoracic surgery. We really built that program up from nothing. It only began 2 years before I came there to what it is now, which is a thriving cardiovascular program. I hope to bring those skills to LewisGale Hospital and replicate that experience here. What inspired me to move to LewisGale Medical Center in Salem is that it's a wonderful opportunity. It's a wonderful hospital. The people I have met here have been fantastic. It's very similar to the practice I came from, which is a close-knit, warm, personable hospital, and offers tremendous opportunity for growth and for provision of excellent service in this community. Outside the hospital, my wife and I really enjoy outdoor activities, which is what attracted us to southwestern Virginia. We really enjoy mountain biking, hiking, skiing. We recently hiked the Tour de Mont Blanc, which is a 100-mile hike through the southern Alps of France. Mountain biking has been a passion of mine for several years, and I really look forward to doing that here in the Roanoke area. I have 2 children. My son is a graduate student at North Carolina State University in mechanical engineering, and my daughter is a undergraduate student at UNC Chapel Hill in environmental studies. We have a cat. My greatest joy is seeing patients improved by the surgery, seeing their lives improved. They're able to live the life that they want to lead, that they couldn't lead before. They're no longer short of breath. They no longer have chest pain. They can perform the activities that they wanted so desperately to perform before, but couldn't because their heart was limiting them. Seeing them improve because their heart has improved, seeing them enjoy their lives, that's what really makes me happy. And it does, that's the truth too. I like fixing things. There's a tradition of excellence at LewisGale Hospital that is unparalleled in Western Virginia, and it is a real privilege to be part of that team to carry that tradition forward.